District Nursing in the Community 2020, the year of the nurse and midwife. How we survived and thrived during the pandemic. The year the strength and resilience of the NHS was tested. A time the invisible became visible. We, the NHS, became heroes. The country was full of rainbows and clapping. Communities became one. District nursing as a service supports some of the most vulnerable in our communities, and while some services stopped or changed their method of care delivery to a more virtual option to reduce risk and prevent transmission of COVID-19, we, the District Nursing Service, continue to provide those face-to-face visits, becoming part of that bridge of support needed by those now more isolated than ever. Working as a district nurse in a rural team within Nottinghamshire, I would like to share my views on how we are currently surviving and thriving during the pandemic as a community team. Looking back over the last 11 weeks since lockdown began, and as a trust we entered business continuity, it would be an understatement to say that as a team we have been through a rollercoaster of emotions, which we have navigated by collaboration, teamwork, resilience and commitment. The district nursing caseload is a ward without walls. We are not capped on admissions or referrals to our caseloads. We manage this by responding and prioritising our workload throughout the day to achieve person-centred care. This is a unique skill which allows us as a team to respond like the ebb and flow of the tide. During the pandemic, these skills have been invaluable and have allowed us as a team to thrive. We have adapted to constant changes in communication, demands in workload, and continued to deliver person-centred care. It sounds strange to say, but amongst the anguish, anxiety and often chaos that has been caused by the pandemic, I have experienced many positives as a service. Constant changes in staffing levels due to staff having to self-isolate due to COVID-19, and also those staff shielding at home, has required staff to move across the locality to support one another, to work in collaboration and to meet the needs of the patient. This has been done without question. We have utilised staff that are shielding at home into the triage role for the district nursing service, and also to facilitate discharges of patients with COVID-19 out of the hospital and into the community setting and back home to free up beds within the acute trusts. The triage role has created a more collaborative approach across the locality and a sense of being in it together. We have continued working in collaboration with our community health colleagues and the multidisciplinary team, including social services, social prescribing, mental health and our GP colleagues. This has been achieved by the wonders of technology and using virtual platforms such as MS Teams and conference calling. In a world of isolation and social distancing, I feel we are more connected than ever. Wellbeing. For the first time and like never before, health and wellbeing of staff in the NHS is on the agenda. The support and resources available through the Trust and wider are such a positive step, something that I hope will remain. Wellbeing has also been supported in the Trust through compassionate leadership, clear and transparent communications from exec level, the daily briefing, to the grassroots. The inclusive communications down from management, the listening events have created a sense of calm amongst the storm, supporting the In It Together motto adopted by many. So, COVID-19, you have given us a rough ride. We have had some highs and we have had some lows during the last 11 weeks. But we have also had an opportunity to develop and learn new ways of working, which we will hopefully continue to take forward in the future.